Charlie.
Yes, sir. Charlie Cradaville. I'm a New Brunswick resident and the editor of New Brunswick Today. I had a few questions. I wanted to ask first about the Helix project and, how big of a component the hospital is in that project.
So we're a small component, but we'll rely on that as something so important to our future in terms of research and education. I think it's going to be truly transformative, both for us and the medical school. It's something that I hear each and every time we interview candidates. That's one of the items that they point out. So for our community, that's very important because specialists from throughout the country are attracted to that. That's one of the major draws from some of the top medical schools in the country. Along with our new dean and her work there, I think we have something special in the making.
Thank you. I also wanted to ask about Plum 2.
Yes.
I know we've talked about it a little bit. It seems a little unusual to me that the hospital's not building the project itself. Instead, you've got a third party building it for you, and you're going to do a master lease.
Yes.
Can you just tell me what led up to that and why that's in the hospital's interest to do that?
Yeah, you asked that question last year too, and the answer's the same. We, in healthcare, many hospitals and health systems work through developers because what we really need to focus on is having monies to hire specialists and build upon our technologies. And if once you're done building on your technologies and hiring the highest level staff, there's very little left to build facilities. So we found a way to finance those facilities so we can move forward and build structures such as that for clinical operations. I'm sure you've heard, as everyone in this room has heard, it's very hard as we bring physicians on to find adequate space for patient care. So it sometimes takes longer than we'd like for patients to get in for their outpatient services. So that building is so important to our future. So I'm glad that it was worked through and worked out so that could happen along with many of the other projects. They're not all with developers, but some of them are. And for the most part, you'll see hospitals and big health systems, people like the Cleveland Clinic, they're looking at their clinical buildings, their outpatient buildings, and that's where they lean toward partnering with the developer.
Okay. And I also wanted to ask about the Cancer Institute and specifically the parking component. I know the county has taken on a role to do that. And I wanted to ask, more broadly how the hospital sees its parking needs and how that may or may not meet those needs. It's an enormous deck, 1,200 spaces, but it'll be for the general public as well as your folks, right?
We've been working with some consultants to help us really understand better the number of parking spaces that will be necessary into the future. Obviously, there's been a lot of noise in that with the pandemic and so many people working from home. So now as people come back to New Brunswick and the other places such as J&J and other offices, we do realize that those numbers could increase in terms of need. So we're looking right now at other options to continue to expand parking. We keep it quite nice for our employees. If you look at the big cities and academic medical centers, sometimes their staff and their newer staff get brought in through a bus service, and we end up renting, or they rent parking spots further away. We haven't had to do that. It may be something we look into in the future. But our hope is to have enough spots because we're committed to our staff. So I think we'll get there.
Thanks. Could you identify the consultants that you're working with on that?
I can't. I'm not sure who they are.
Okay, but if I follow up, maybe?
Yeah, if you follow up, that'd be great.
I will do that. And one other item I wanted to talk about is one that was a big discussion last year, but I think just a few days after the meeting, the FTC put the kibosh on the St. Peter's University Hospital merger. I just wanted to ask for a status update or, what you see as the vision for the future.
Yeah, it's disappointing, and I appreciate your support last year and everyone's support in terms of that transaction. We have some folks here from the community that also work with us in partnership over at St. Peter's, so thank you for being here. We truly tried to bring the two hospitals together and have St. Peter's join our health system, but the Trade Commission did not approve it, so now we have to move on and try to figure out how to continue on the road to premier academic. And as you know, and everyone in this room, space is always a constraint on us and other medical centers. So we're going back to the drawing board and being as strategic as possible so that we can continue to expand. And you saw in those slides, I'm sure, the growth is amazing. Coming out of the pandemic, where we are, I mean, we have record volumes and continue to have record volumes. So luckily, RWJ, prior to merging with Barnabas, they worked to bring in community hospitals such as Hamilton and Somerset. So we're working very closely with them, and that gives us additional capacity. So again, maybe we'll get back to it one day with St. Peter's, but once it was denied, we have to move on and look at other options.
Okay. And the last question I wanted to ask was just if you could talk broadly about what you see as the biggest public health problems, crises, concerns for New Brunswick residents. And I'd also like to share what, yeah, sure, yeah.
Yeah. Well, if you listen to Miriam's presentation, it's really listed pretty clearly with the community health needs assessment. Every 3 years, we work on that project with St. Peter's. We've been doing that for years. So it clearly outlines what the issues are. And we believe, and I mentioned this last year, I think it was a similar question, the FQHC, Chandler Health Center, is so important. It really starts there. It's primary care, making sure folks are doing everything they need to remain healthy. Food and nutrition, Mariam pointed out, as you saw in her presentation. I think that's a big one. And we continue to try to serve the homeless as well as we can.
Yeah, and so I just wanted to make a comment that I think the three biggest public health problems facing our residents here are gun violence, addiction, and you alluded to it, the climate crisis. The smoke that is in our air and in our lungs today, unfortunately, is the result of, compounded decisions over so many years that have led to more extreme weather, aridification of certain regions, more frequent wildfires, and lower air quality. And so I just wanted to ask if you could address what the system is doing or what the hospital is doing about those three issues: violence, gun violence specifically, addiction, and if anything, the climate crisis.
Addiction, as you know, that's been a real focus that our health system has been really not only being strategic about, but funding services. We have addiction specialists in every one of our emergency departments, so no longer is a patient discharged without a navigator, someone holding their hand to make sure they get the services they need. You can't force it, but you definitely can connect, and that's something that I'm proud of our health system. I'm proud of Robert Wood. It's not something that you advertise, but they're there in our ER, and they're brought into the patients so that we can navigate them. In terms of gun violence, I wish you were with us. Just the other day, we had a presentation from Dr. Narayan, who's here as our new chief of trauma. And he comes to us from Cornell. He's one of the most recognized trauma surgeons in the country. I could possibly say the world. We're lucky to have him, and his presentation starts with, it's not about the care we give when there's the traumatic situation. It's about educating the public and community as to how to avoid traumatic situations. So I think he's doing a fine job, and that will continue to grow. So I believe we'll be on that. In terms of the environment, we do look in terms of the building that we're doing to see how we can better serve the community. Rutgers does an unbelievable job in really evaluating the things we do and the impact on the environment. So not to get into another hour of presentation, but I do think that that's something that we will continue to work on and work with Rutgers to improve that as much as we can.
Well, thank you for answering my question, sir.
Any other questions?